Mental Health Case Scenario Presentation, presented by Team 2 for the Community and Mental Health Nursing. This is the table of contents of the presentation that are clearly identified and discussed by all the members of the team along with our case problem. Our case problem is a widowed man, 40 years old, named Mr. John Michael, who came to the community center with concern of how he could manage since his wife died. Mr. Michael was born and grew up in Canada. His wife just died a month ago due to chronic obstructive pulmonary disease at the age of 40. They have two kids left with him, Julie, 7 years old, and Jeremy, 10 years old, and both are currently in grade school. They live and own a bungalow house at 71 Cabbage Town, Toronto, Canada. Mr. Michael is a construction worker whose income is limited and he's having hard time to support his kids physically, emotionally, and financially. He did not finish high school that caused him difficulty to apply other jobs for additional source of income. Due to lack of time, he mostly buys fast foods for them. And in the morning, he needs to prepare his kids first before he goes to work, which causes him to stay late at work or cannot go to work anymore. When his neighbor friend is available, he asks help to look after his kids so he could work and come back home early. His in-laws are living nearby town but both are old and retired and which only visits them rarely, while Mr. Michael's family is living in Vancouver. When he comes back from work, he's more tired and exhausted. He could not spend time with his kids and other social activities. He noticed lately that he's becoming more irritable, impatient, and his mood changes frequently from being happy to sad. He feels demotivated, less energy, and feels like he's not happy anymore. He has no intention to hurt himself or his kids because he loves them. He's becoming a heavy smoker and been having trouble sleeping since his wife died.
So let's talk about the definition examples. Here first is the definition of the grieving. Grieving is a normal response to a loss. Grieving is defined by the National North American Nursing Diagnosis Association International as a complex normal process that includes emotional, physical, social, spiritual, and intellectual responses and behaviors by individual families and communities incorporated loss into their daily lives. Next, there is a definition of the depression. Depression is characterized by persistent sadness and lack of interest or pleasure in previously rewarding activities or enjoyable activities. It can also disturb sleep and appetite. Tiredness and poor concentration are common. Depression is a leading cause of disability around the world and contribute greatly to the global burden of disease. The effects of depression can be long-lasting, recurrent, and can dramatically affect a person's ability to function and live a rewarding life. Next, the examples. According to Canadian Mental Health Association, examples of depression, of grief and loss which leads to depression are death of a loved one and loss of health and the ability to do things as usual. Next, here is the statistics according to Cabbage Town, Toronto, Ontario. In Cabbage Town, mental rate is higher and unemployment rate is graded as D in Cabbage Town, which is approximately 5.5%. Median household income is $55,394, which is 27%. Labor force is 67%. In males between 45 to 65 years old, mental health illness is 15.4. According to Cabbage Town St. Jamestown profile, the widow population 385 people, which is 5% in city, according to Stats of Canada 2016. Male alone parent families are 3% in Cabbage Town, Stats of Canada 2016.
Hi everyone, my name is Rachel Kava and I'm going to discuss about the nursing consideration. Our team identified 11 nursing consideration and these are smoker. As stated in the case scenario, the patient is a heavy smoker and his wife died of COPD. We can integrate the smoking cessation and educate the effect of smoking to his health and to his family. Relies on fast food. Educate the importance of eating a healthy meal and the effect of regularly eating a processed food that can lead to serious health problems. Overwork. The impact of overworking to his health and his family. Insomnia or having trouble in sleeping. Socioeconomic status, since in our case scenario, the family has a limited source of income. Age, since the bracket age for men who is having depression or prone of having depression is 40 to 65 years old. Lack of support, have a negative life event regarding the loss of his wife a month ago. Identify what phase of grieving being experienced by Mr. Michael and his family using the DABDA by Elizabeth Kubler-Ross. Determine Mr. Michael's capacity to make decisions. Identify the resources or support system the patient have in their community. Next, I'm going to discuss the assessment tools. We identified 2 assessment tools. Depression in adults, 2-item depression screening questionnaire. The purpose of the PHQ-2 is to screen for depression in a first-step approach. Consists of 2 questions about depressed mood, and these are: during the past weeks, have you often been bothered by feeling down, depressed, or hopeless? During the past month, have you often been bothered by little interest or pleasure in doing things? Patients who screen positive be further evaluated with the PHQ-9 to determine whether they meet criteria for a depressive disorder. Next is depression in adults, 9-item PHQ-9. This is a structured depression rating scales. The PHQ-9 is the 9-item depression scale for the patient health questionnaire. It is one of the most validated tools in mental health and can be a powerful tool to assist clinicians with diagnosing depression and monitoring treatment response. The AIM Center Advancing Integrated Mental Health Solutions identifies some of the advantages of the PHQ-9, such as can be administered in person by a clinician, by telephone, or self-administered, facilitates diagnosis of a major depression, and provides assessment of symptom severity. Next is the assessment. Our group identifies some of the signs and symptoms of Mr. Michael is experiencing. We identify it through subjective and objective. Under the subjective, these are: I feel extremely tired most of the time. I'm having trouble in sleeping. I am having difficulty to focus and making decisions. And under the objective, these are sudden changes in the mood and becoming irritable, look weak and tired, no pleasure from the activity, trouble making decision, and inability to concentrate.
Assessment. Related determinants of health at risk. Education. He did not complete his schooling that caused him not to find a stable job. Income. He has a limited financial source. The income is not enough to support the family needs and other expenses. Employment and working conditions. It's a seasonal and temporary work. It's a tiring and risky job. Early childhood development. The kids are not receiving enough parental guidance and care because the father does not spend much time with them, and they lost their mother. Lack of time for children's social activities and development. Food insecurity. They are receiving inadequate nutrients because of their food choices and not enough income. Social exclusion. They don't have time for social activities. Social safety network. Lack of awareness in the available social safety network. Gender. Mr. Michael is male, heavy smoker, and risk for chronic obstructive pulmonary disease. He is male. He is adjusting on how to do household chores and caring of his children. He has inability to use the right coping skill after the death of his wife. Race. The family is raised and guided by Western culture. Disability. Inability to manage and make decisions due to the loss of his wife, stress and trouble sleeping. Assessment. Barriers to health services. 1. Income is limited. If he gets sick, he could not provide all the needs such as medication. He does not have a private insurance. 2. No time to go for regular checkups or to see a doctor. 3. Lack of support system available. 4. Not aware of the available resources in the community to use. 5. Lack of health education about nutrition and coping skills. Assessment. Challenges to face with this client. 1. Unable to provide the family needs due to lack of financial support sources. 2. No consistent support system available. 3. Refusal to have counseling related to the loss of his wife. 4. Not considering other services to help the family in coping.
For the nursing diagnosis, the first one is the functional grieving related to stress of wife death, then sleep pattern disturbance related to grieving, mood changes related to lack of sleep, and an effective social interaction related to lack of support system.
For expected outcome and goals, after 2 weeks of providing the care needed by Mr. Michael and family, he will be able to engage in normal grief process and use effective coping mechanism, experience adequate rest and sleep, effectively function his role and properly use of coping skills, effectively and appropriately utilize the community available resources.
For the planning, since Mr. Michael is experiencing depression and difficulty in adjustments to life after his wife died, the following strategies can be used to help him. First, assess his mental status. Second, establish good communication with him to allow verbalization of feelings. Third, build relationship with him to promote trust. Fourth, use language that shows consideration and respect. Fifth, provide sensitive patient-centered care by encouraging involvement. Sixth, consult with knowledgeable mental health professionals. And last, refer to the community services available.
Intervention. Building trust to Mr. Michael and family. Several ways are: communicate effectively. Having effectively communication is the foundation to establish the trust of the patient. It helps to know your patient more, gather information from them, and to know their concerns. In addition, communication effectively serves as a tool to educate the patient to enhance their condition. Introduce yourself. Introducing yourself to the patient is essential. This will help to improve positive nurse-patient relationship, and it also helps to make your patient to recognize the nurse during providing care. Show your patient you're listening. Making eye contact and follow-up questions are signs that a nurse is attentively listening to the patient. This will give a benefit to gather more information about patient history. Dress professionally and appropriately. Nursing uniform serves maintaining safety and hygiene standard in nursing profession. This will help to build the trust of the patient. Show respect all the times. Showing respect to the client, such as providing privacy, respect for culture, beliefs, and opinion of the patient are essential in nursing profession. In this way, it can build the trust of the patient. Be honest and keep your word. Avoid making promises to the patient and keep your word. And be honest regarding about the situation. This will help to establish and gain the trust of the patient.
For interventions, assisting healthy food choice and eating habits, assisting to routine sleep pattern, assist to manage daily activities, encourage and provide option relaxation activities such as yoga and meditation, help to identify to develop his coping skills, and encourage to join social groups, assist him decision to making process.
Interventions. There are some community sources and partners that help to create a well-linked system to improve health by expanding options and support for clients suffering from mental health issues. Here we can refer Mr. John to some community sources such as Center for Addiction and Mental Health. It provides high-quality, client-centered care to meet the diverse needs of people facing addiction and mental health challenges. In addition, its services include assessment, brief interventions, inpatient services, day hospital services, continuing care, outpatient services, and family support. The second one is Mood Disorders Society of Canada. It is Canada's only national voice for Canadians who are suffering from depression and other mood disorders, along with their families and caregivers. The third one is Canadian Mental Health Association. It is a voluntary organization that provides services and raises awareness about mental health. Moreover, it provides resources to people to maintain their mental health, integrate into their community, and support recovery through peer support programs. Refer to community partners available in the community. Community mental health centers and outpatient programs to help Mr. Michael to care for his children and while he is at work. Cultural group, immigrant, refugee or veteran agencies sponsored as assistance. Food and clothing banks to provide assistance on their food supply. Social service agencies such as vocational retraining programs to provide additional financial income. Educating and referring clients to legislation subsidies available for them. There are two specific pieces of legislation govern how people with mental health conditions receive care and treatment. Number one is Mental Health Act 1983. It was updated by the 2007 Act. This act tells us how a person can be admitted, detained, and treated in the hospital against their wishes. This also ensures that patients' rights are upheld. The second one is Mental Capacity Act 2005. This act allows somebody to make decisions on behalf of a person ages 16 and above it according to their interest.
Educate and refer client to legislation or subsidies available for them. In this case scenario, the client need different legislation and subsidies which can help us financial condition. Medical Canada Education Saving Grants. The Canada Education Saving Grant from Government of Canada to help your client saving early for the child education after high school. Childcare subsidies provided by government based on the parent's gross income. Canada Emergency Wage Subsidy or CEW's Federal Wage Subsidy Legislation Bill C-14. Canada Recovery Caregiving Benefits CRCB gives income support to employed and self-employed individuals who are unable to work because they must care for the kids who are under 12 years old. Temporary care assistance. If you are looking after a child in financial need and may be able to receive financial help. Family Medical Leave Program. It enables employees to take family medical leaves up to 8 weeks to provide care and support to a specified family member who has a serious medical condition with a significant risk of death. Connex Ontario Drug and Alcohol Helpline provides information about drug. Mortgage Loan Insurance. This program provides insurance on loan granted for the purchase, constructed, renovation of refinancing of single family home or multiple rental housing. Employment insurance. EI and voluntary leaving, how badly affects your eligibility for employment insurance. Goods and service tax or harmonized sale tax. This credit program issue full and partial goods and services tax credits to Canadians with low income.
Interventions. Educate and refer to local resources for clients that suffer from the depression. Clients experiencing depression after the loss can be helped with resources in the community such as individual therapy, group therapy, peer support groups, grief and loss counseling, family support, anger management, in-person crisis intervention, smoking vaping cessation, family counseling, community mental health agencies, and distress lines. Evaluation. After 2 weeks of helping and working together with Mr. Michael and family, Mr. Michael expressed feeling better and accepted the changes in their life after his wife died. He is able to manage household chores, his work, and taking care of his kids. He expressed having uninterrupted sleep at night for at least 8 hours. He is able to demonstrate the use of his appropriate and proper coping skills. He is aware of what resources available in the community and how to utilize them.
The last 3 slides are the references used by the team for this presentation. Thank you and have a good day.